Hey folks, welcome to DocTalk. You're stuck with me today. We're going to talk about AIP in cattle. It's going to be a good show, I think, tying together some misconceptions that we think about and see and talk about when it comes to acute interstitial pneumonia.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson here at Kansas State University's College of Veterinary Medicine, where I serve as the Jones Professor of Production Medicine and Epidemiology and host of DocTalk. Thanks for watching us and thanks for joining us. Today we're going to talk about acute interstitial pneumonia or atypical interstitial pneumonia. Most of you have heard it classified as what we call AIP. So when we hear AIP, we're talking about the two different terms, acute or atypical interstitial pneumonia. So what interstitial means is within the cell, okay? So the interstitial means that in the lining of the cell or in the alveoli of the cell is where this is occurring. And so pneumonia obviously means lung. When we say bovine respiratory disease complex, that's more of a bronchopneumonia, or the infection not within the lining of the lung, but within the saccules, air saccules, or the bronchus of the lung. So when we think about this, most of the time AIP is some sort of disruption of the surface of the cell lining that causes the cells of the lungs to increase in size, or maybe it's something that comes through the bloodstream to the lungs that is then distributed to the cells of the lungs that causes this to happen. So it's acute or atypical, and acute means it happens like that. And a lot of times these cattle don't show any clinical signs, and we have some sort of disruption that tips them over to having this interstitial pneumonia or AIP. And I know that everybody's like, well, I don't see this in cows. The only time we really see AIP in cows is back in the old day, we called it fog fever. And fog fever was when we would turn cows out on lush forage and on river bottoms when it was foggy. And the cattle would graze that lush forage and they would overconsume an amino acid called tryptophan. And when they would get too much tryptophan, the rumen would then convert it to 3-methylindole. Okay, don't worry about that term. But that is what then was transported to the lungs. And once it got to the lungs had an enzyme that converted that to something that was pneumotoxic or something that caused a disruption of the lining of the lungs and would cause this interstitial pneumonia. Now, when we see interstitial pneumonia in a calf that is suffering from it, the lungs will look overinflated. Matter of fact, when I do necropsies of these, we'll come in and you'll actually, after you break the ribs back, you'll still see the indentation of the ribs in the lungs because they were so overinflated. And they're extremely heavy because this interstitial is filled with fluid. And so when we pull the lungs up out of the carcass, we will have these over-enlarged, heavy, wet lungs, okay? And some people will say that when you grab them and you squeeze them, it feels like a bag of marshmallows is what the lungs will feel like, is kind of the description. When we'll take a break here, but when we come back, what we're going to talk about are the clinical signs of AIP and what animals look like, which animals are most predisposed to it, and we'll talk about how that has changed from the fog fever in the cows out on lush forage to what we see today in feedlots as AIP. Thanks for watching DocTalk. Stay tuned after this message.
Watch Ag AM in Kansas online at agaminkansas.com.
Clyde Sutton, Ness City, Kansas. Lived on this place all my life. About a year and a half ago, got to where I couldn't saddle a horse. The pain was terrible. Read about stem cell. First it wasn't for me, then they started doing neck and back. Went and had it done. As you can see, I saddled a horse. I'm still building fence. Love to shoot a shotgun rifle, and I'm able to participate, not like I used to, but nevertheless I can do the things I used to do, and life is good.
As fourth-generation farmers themselves, Heinen Brothers Ag Service understands the risk and rewards of farming. So when it comes to quality aerial and ground application, fertilizer, ag chemicals, and anhydrous ammonia, call Heinen Brothers Ag today, 800-760-4964.
Ag Promo Source is a unique group of marketing specialists with one mission: help your ag business grow. Each affiliate has their own area of expertise, and they work together to bring you advice, products, and services. To get started, visit agpromosource.com. Ag Promo Source. Together we grow.
This segment brought to you by Santa Fe Trail Meats in Overbrook. Visit us online at sftmeats.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here. We're talking about AIP in cattle. Now, again, most of you cow-calf guys are like, well, I don't get AIP, but I will promise you that if you retain ownership and feed cattle, you've probably gotten, if you fed a lot of cattle, you've probably got one of those slips in the summertime that say, hey, you had a heifer tip over from AIP. So, which animals are most predisposed to AIP? Normally speaking, in feedlot cattle, we see it the most in the summertime. We have a higher prevalence, or have documented a higher prevalence of AIP in heifers than in steers. And most of the time it's cattle that are have longer days on feed. So big heifers in the summer, which obviously that's when we slaughter a lot of cattle because of barbecue season, is when we see atypical interstitial pneumonia or AIP in cattle. So I've done some research on this and looked at the human literature. And in humans, they have a syndrome similar to AIP. They call it ARDS, acute respiratory distress syndrome. Now, you'd say, well, why don't you just go find what causes ARDS? Well, when we look at the ARDS, some of the similarities is that it happens in females more commonly than males. That's about it. But what they have learned in the human literature is that there are 60 different causes of ARDS known in the medical field to cause ARDS in humans. 60 different etiologies or causes. And we tend to think about in cattle that we're going to find that one cause of AIP or that one thing that causes AIP. And what I've come to the resolution is that atypical interstitial pneumonia is a pathology or some sort of physiological and physical phenomenon that can be caused by many different types of things. In humans, some of the most common causes are aspiration pneumonia, whether it's water or feed particles, something that you inhale, water. Another one can be endotoxins or septicemia. If you get a bad case of pneumonia or you get some other infection that goes into the blood and the bloodstream goes to the lungs, that can be a very common cause of ARDS in humans. Inhalation, heat stress with inhalation of smoke is another cause of interstitial pneumonia in humans. So you can start to see some of the patterns. Inhalation of a substance that washes the surfactant off the inside of the lining of the lungs, something that we breathe in that could cause an irritation to the lining of the lungs, or something that comes through the bloodstream such as endotoxin or a bacterial infection that can set up an interstitial type pneumonia within the lining of those lungs. So those are some of the types of things we're going to talk about when we come back from break, is how do we kind of start to think differently about AIP in feeder cattle rather than just thinking about something in the feed or something in the dust, and start to think about this as a multifactorial type disease that then we can start thinking about ways to prevent it. Thanks for watching DocTalk. We're going to take a break. We'll be back right after these messages.
Your investment in the Beef Checkoff is opening new doors for beef. Today and tomorrow, our commitment to long-term planning helps ensure your profitability from one generation to the next.
Hello, this is Caleb Plyler and Son Charolais. This is my son Hook and my wife Brianna. And we operate a purebred Charolais operation in Hope, Arkansas. You know, in the business that we're in, the beef checkoff dollars are very important to us. A lot of that money is to educate people, just like kids that's in Huck's class, the importance of eating beef. You know, it's a high protein product that it's a very important part of our diet. Sometimes we get this bad rap as beef is not, you know, what we really need to be doing from a dietary standpoint. But, you know, being able to get to the kids and let them know that, you know, beef, it is what needs to be for dinner. You know, one of the bigger things with our family is getting to go out and show off some of our cattle. Huck, he gets to show a lot of heifers. A
lot of what we do trying to get him into showing is the fact that it's teaching him discipline, respect for the animals, and it's going to continue to give him lifelong skills throughout his life.
But I think it's very important that, you know, the next generation understands how important the beef industry is. Just like Huck here, we plan on him one day operating this farm. And, you know, if we can do that, we're doing what we need to. Because, you know, this country is founded upon people that, you know, have family traditions and do a really good job of keeping those traditions going. Huck, one day, what kind of cows do you want to grow up to have, you think?
Charolais.
Charolais, all right. You know, if the beef checkoff dollars are going to really good causes and really promoting beef, then the consumers are going to want to buy more beef, and that leads for us making more money in the end, and it really helps the quality of people's cow herds because we're able to enhance our genetics even more.
Sure Crop Fertilizers was started by my father, Don Sherman, and my mother, Shirley Sherman. Family business that started in the 80s. We predominantly focus on plant nutrients and what we can do to give growers better responses with the fertilizer dollars that they do, and what we can do to make those things work better for the grower. We're based out of Seneca, Kansas. We work with growers in their soil analysis to figure out what they need, and then we can put those in a blend that gives them the best results, and so that we can deliver that direct to their farm so that they have those nutrients where they need them, when they need them, and so that they can apply them in a manner that's very efficient to them and works well on their planting systems and what they're doing. Sure Crop Fertilizers has been around for a long time. We always say we're big enough to take care of everything you need, but we're small enough to do it quickly. You can get a hold of us at 1-800-635-4743. Our website is surecropfertilizers.com, and you can always email me at Corey@surecropfertilizers.com, and with any questions you have, and we're glad to answer it and work with you.
Hi, I'm Kim Mandarin with Hardy Insurance. I'm here to help you with all of your farm and ranch needs. When it comes to protecting your operation and your family, you need a name you can trust at a price you can afford. Call me today or visit hardyaviationins.com.
Healthy cows start with the new Hired Hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new Hired Hand makes healthy cows easy.
This segment brought to you by Kansas Soybean Commission. Progress powered by Kansas farmers.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here. We're talking about AIP in cattle. And again, when we get to the summertime in feedlots, some of the things that we start to worry about are fatigue cattle syndrome and AIP, or acute interstitial pneumonia. And as we discussed, there are many different causes of this syndrome in humans, and we would be foolish to not think that there are many different factors that could cause AIP in feeder cattle. And I think that some of the things that we start to think about in feeder cattle are dust, heat stress, the combination of heat stress. And one of the models in which they cause ARDS in sheep is to actually heat up the outside of the body and then expose them to, this is for human research, they use sheep, they'll heat up the outside of the body and then expose them to cotton smoke. And that will elicit AIP in these sheep. And so when I start to think about the combination of heat stress in the summer, dust in the pens, those types of things can probably lead to higher prevalence of AIP. When we feed, we don't think about this, but we clean pens when we ship cattle. And so when we feed yearlings, we're cleaning those pens out twice a year. When because they have shorter number of days on feed, and we turn the pens over twice. When we feed a lot of calves, we're only cleaning those pens out once or turning those pens once a year, and so we'll have more dust accumulation. So looking at the population of cattle within the feedlot, I think, is important. I think that if there are more calves, there's probably going to be more dust, and if there's more dust with heat stress and more heifers, we're going to probably see more incidence of AIP or ARDS in cattle, okay? Water tank space. If we don't have enough water tank space, some of the things, when we talk about aspiration pneumonia, and I see those cattle that are up around water tanks and they're hovering over the top of water tanks, I can see a calf that's sitting there just trying to get cooling from the water in the water tank, and another one is getting a drink, and it comes up there and butts him in the side, and inhalation of water when they're really overcrowding at the water tanks. I think that could be an issue. What I'm trying to get to is, let's start thinking of different ways that we can start to think about the cause of AIP rather than thinking about one or two things and just putting something in the feed to prevent it. I think that when we start to look at management to prevent it, I think that shade, anything we can do to alleviate heat stress, will decrease AIP incidence. I think that increased water tank space has an opportunity. Dust collection and pen grooming is something else that I would concentrate my efforts on for AIPs. And then lastly, when we start to think about some of the different etiologies, obviously endotoxin and septicemia, whatever we can do to prevent bovine respiratory disease in cattle and potential endotoxemia from the respiratory disease or from the dust that's being inhaled are different things that we need to think about. We used to think this was an infectious agent like bovine respiratory syncytial virus, BRSV, and we vaccinate for it all the time. But what we have found is that cattle that have died without AIP, about 10% of them we can isolate BRSV, and about 10% of the cattle that die with AIP, we can isolate BRSV, so there's no difference in the infection rates. When we come back, we'll talk a little bit about treatment of AIP in cattle. Thanks for watching.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help? How can we help?
Hey folks, Dr. Dan here. Thanks for joining us for our Cattle First Minute as sponsored by Behringer Ingelheim Vet Medica. And today we're going to talk about identifying sick cattle. And the first thing I look for in identifying sick cattle is cattle that aren't eating. So we're going to look for slab-sided or gant cattle, and sick cattle don't eat, and cattle that don't eat get sick. The next thing I'll look at is depression. Is the animal depressed? Does it have a dull, listless appearance? Does it try to just kind of snake away from me? And so a calf that's not coming to the bunk, one that's got a dull appearance, depressed appearance, those are going to be my two big clinical signs to get those calves out of the pen. And so the DART method, depression, anorexia, respiratory rate, limping, other things that will show you signs that cattle are sick or that cattle need to be helped.
We do business with Blueville because of the quality of their work. It is excellent quality, and because they make a commitment to their customers.
We enjoy the benefits of hiring a good company to help us maintain this home.
We will always do business with Blueville. We have for many, many years, and there's no reason for us to look for any other service.
This segment brought to you by Kansas Farm Bureau, the voice of agriculture. To join today or more information, go to kfb.org or find us on Facebook or Twitter.
Hey folks, welcome back to DocTalk. We're talking about AIP in cattle, and you can see from the pictures of different sets of lungs and things to that what AIP looks like. It's pretty easy to diagnose in feeder cattle and when we have it. And so now the question is what do we see with clinical signs? And the clinical signs of AIP, and how are we going to treat it? So when a calf has AIP, this calf, they'll go into severe respiratory distress. And one thing that you need to understand is that if you hear a noise during breathing, if you hear the noise during inspiration, it's in the upper respiratory tract, meaning above the thoracic inlet or above the lungs. If you hear the noise on expiration, that means it's a lower respiratory tract issue. And obviously with AIP, it's lower respiratory tract. So these cattle with these overinflated lungs have a hard time exhaling, okay, because of the fluid-filled lungs. So they'll breathe out and they'll have this expiratory grunt with them. A lot of times with cattle with AIP, they'll go try to hover around the water tank, and they are so in respiratory distress they can't even take time out to take a drink, and they're dehydrated. So these cattle are going to be having, they're big cattle, they'll have a swayed back trying to use their belly to breathe with, they'll have an expiratory grunt, they'll have open mouth breathing, and you'll notice that they're in severe respiratory distress. Honestly, it's very difficult to differentiate bovine respiratory disease in a heavy animal versus AIP, and a lot of times we treat them the same because we can't determine it until we get to the dead pile and do a necropsy. Now, if you use a stethoscope, the noise from AIP will be throughout the entire lung, and the noise from bovine respiratory disease will be in the front and lower portion of the lung. And that's how I kind of differentiated at the chute as a veterinarian, okay? Now, the bad news is this. There is no treatment for AIP that is effective. In humans even, 50% of humans that get ARDS die from the syndrome, and treatment is not effective. The most common treatment is low dose of anti-inflammatories such as dexamethasone and ventilation. And so they'll put people on ventilators and try to ventilate the people. We don't have ventilators for cattle. And so our best thing is, if you know this is AIP, first of all, if you treat it with an antibiotic, understand that you have a withdrawal or a hold on that animal before it can be sold. Understand that if it is AIP, an antibiotic is not going to do any good to help treat it, okay? The thing that we've been doing, since this is non-infectious, these animals are not condemned at slaughter, is we'll actually send those animals to emergency slaughter, or if we're shipping a load, we'll actually put those animals on the load and ship them for slaughter, because this is just a syndrome that is non-infectious, that is caused by many different things, whether it's dust or water inhalation or septicemia or endotoxemia, that you will not get that animal rejected. So those are some things that we're doing. Understand the clinical signs, understand the animals at risk, long day heifers during the summer. Those animals are going to present in severe respiratory distress. Remember, if you hear the noise when they breathe in, it's upper respiratory tract. If you hear the noise when they breathe out, it's lower respiratory tract. You can't diagnose it at the chute between BRD and AIP without a stethoscope. And so those are some of the things that we make sure, understand the population, the clinical signs, how to diagnose at the chute, and then understand that there really is no effective treatment for AIP in cattle. So that'll wrap up AIP, folks, and thanks for joining us today. Remember, if you want to know more about what we do on DocTalk, you can find us at www.doctalktv.com. Always work with your local veterinarian. I hope you enjoyed the show today. Thanks for watching us. I'm Dr. Dan Thompson, and I'll see you down the road.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com.